Hello folks, how are you doing? Long time no see, Don Kelly here. I hope you're all keeping well and everybody getting ready for the Christmas ahead. Okay, I'm going to do a quick vlog, couple of minutes, and the reason I'm doing this one is because earlier in the month, or it could have been maybe a couple of months ago, I put up a post about carpal tunnel syndrome. And so because there has been an awful lot of reaction and comments on the post regarding it, over 20,000 people have seen it, by the way. So I just said I'd talk about carpal tunnel syndrome and give you a little tip on how you can help relieve the pain. So anybody out there who has carpal tunnel syndrome, or if you don't know what that is basically pain in your hands, numbness, pins and needles, even pain in the forearm, but generally around the wrist and the hands. So anyone suffering with that type of pain, or anyone, just tag them in this or send them on the video. But if you go through my Facebook feed, you will see I have an article written up there about it as well and how you can manage it. So carpal tunnel syndrome. Now, there's a number of ways of dealing with it. Okay, surgery is the most common. It happens quite a lot and it can be very successful, and in a lot of cases it's not so successful. Okay, but either way, that's one of the ways it is treated. Another way it is treated with a steroid injection, and again, it can be very successful, the steroid injection, and in other cases it's not so successful. And the third way of treating it, and my preferred way, is through physical therapy modalities, acupuncture modalities, and specific exercises to basically relieve the stress and the tension around the wrist and on the muscles that can be causing the pain into the hands, the pins and needles, the numbness, whatever you want to call it. Okay, so anyone with carpal tunnel or who have had it will know all about it. They get lots of pain in the hands, lots of pain in the wrists, and they can present with pain in the elbow in some cases and in the forearm. Either way, in my opinion, a lot of it is connected. You see this condition a lot with people who work with their hands. So electricians, anyone, carpenters, anyone who does fiddly work with their hands, working in factories, who work on computers, typing, bricklayers, anyone who works a lot with their hands, where their hands are being overworked, will present with this condition, or can present with it. So how do you manage it? Well, first of all, you should always get it medically checked. Anything that where you're getting a neurological pain like pins and needles or numbness, loss of power within the hands, you should always go and check that out with your medical professional, your GP, ideally, or a reputable or a good physiotherapist will help you there. But anything neurological, especially loss of power, you're definitely looking at getting a referral, quite possibly for an MRI as well. But go to your GP regarding that with any kind of neurological loss of power type discomfort. But anyway, anyone with the pain, presenting with the pins and needles, I suggest you try these simple exercises before you go down the route of surgery. That's my advice, okay? If these exercises don't work, along with physical therapy and acupuncture modalities, then I would suggest you would further investigate it. So here we go. Very simple. It's not as hard as you may think. For anyone who has carpal tunnel syndrome, pain in their hands, pins and needles, numbness, it's a simple little exercise. You go into a prayer position, put your hands into a prayer position like that. Bring it back into your chest, like this. Okay. And what you will do is, keeping the heels of the hands together, like this, you'll push down towards your belly button and raise the elbows. Can you see that? So the elbows are raised, the heel of hands are together, and now you will feel a stretch underneath the wrist. Hold that. My advice is do that loads and little. Hold it for 5 to 10 seconds. Take the pressure off. Just move the wrists around. like you're conducting an orchestra. Okay, just open the fingers like that, just flick them open, and then repeat. Push down, heel of hand together, push down and lift up the elbows. You see them there? You see them there? You will feel the pull. You'll see in the wrist area, and you can even do this. Once you're getting the stretch and pull there, you're working it. If you push it away from you like this, you get a bigger stretch. It should never hurt. There should never be pain. If it's painful, you just reduce the tension and the stretch. Very simple. That's all. Try that. There's other ways of stretching the forearms, but that's by far my favorite and by far the easiest way to work it. So if you do that, repeat it 2 or 3 times, 5 to 10 seconds throughout the day. You could go a long way in helping alleviate your carpal tunnel syndrome. But I would always recommend you try those exercises before you go down the route of surgery or even steroid injections. But if it doesn't help, then you might need to go down that route. Basically, the tendons, the nerve gets impinged in the carpal bone there, a lot of the cases. So by doing that, you're opening up the joint space, so you can reduce the stress on the nerve and the tendon, which causes the pain, the ligaments and so forth. So always flick your hands, and even just by moving your hand as if you were conducting an orchestra, that releases, it creates like a little movement within the carpals, and that can free them up as well. Just moving your hands, flicking them out like that. Do loads of that, guys, because what happens is, it's like anything, when we start getting pain, and we'll talk specifically of the hand and the wrist, if we start getting pain and discomfort, what we tend to do is we tend to mind it and we tend to protect it. So what happens is we use it less, and then when it gets used less, the symptoms will increase over time. So I tell everybody, movement is medicine. So like anything, you move them. So instead of protecting your hands and minding them and nursing them like this, start opening them up, start using them. Okay, all within the threshold. There should never be pain. If it gets uncomfortable, you stop. You've enough done. When it settles, you can go back doing them again. So that's a nice simple little exercise for wrist pain, hand pain, pins and needles, or what's commonly known is carpal tunnel syndrome. It's one of the names for it. Who's that? Jean, Don, any advice for pain in the elbow? Jean, is it on the inside elbow or outside elbow? The inside, is it in here or out here? Tell me no. So that exercise works great for the inside elbow. Okay, very good. That will work for the medial elbow. Okay, that's golfer's elbow. And for the outside elbow, a great exercise is, if you can see me, hit your hand and bring it backwards and turn your palm of hand out. Do you see that? Great exercise for elbow pain. Do those. Prayer, and bring your hand back and turn your hands away from you as if you were catching a ball from the outside. I hope you can see that. But that will help with elbow pain, and you can just do a little bit of self-massage. Pin it and roll. Pin and roll. Pin and roll. Pin and roll. See that? Pin in the elbow. So if it's on the inside, you do the same. You pin and roll. Pin and roll. Pin and roll. But move it. Movement is medicine. Just make sure there's no pain while you're doing those exercises. Jane, if you look through my Facebook page there should be some exercises there for elbow, but they're the 2 easy ones. Just make sure they don't hurt when you're doing them, alright? So guys, hope that helps. Keep me posted, Jean, how you get on with those exercises. They should help. If the pain is continuous, you can hot water bottle. It gives great relief. And also, if you've anyone with pain on the elbow, if you do 2 minutes ice, 2 minutes heat, and do that for 20 minutes, and do that twice a day, that can help as well. So never put ice directly on the injury, okay, where the point is sore. Always put it in a wet cloth or something. So for example, if you put the ice on the sore area for 2 minutes, take off the ice and then put on some heat, like a hot water bottle, for 2 minutes, take that off, and then ice again for 2 minutes and so forth. Repeat that for 20 minutes twice a day, and that will help give relief as well. But the main thing with it is avoid anything that aggravates it. So stop lifting anything that's making it worse, and just do the exercises in the meantime that I have showed. And that goes for all pain really, but generally more specifically for carpal tunnel and everything. Okay guys, thanks very much. Okay, sorry Gina, I'm blind as a will do. I'm getting great, so great stuff. All right, Jean, thanks for the feedback. Guys, I'm going to go. My next patient is just outside the door. Have a great day, and God bless you all. And if I don't talk to you before Christmas, have a great Christmas, and the best of luck to Limerick tomorrow. Well, hey, Limerick-a-boo. Good luck and thanks. God bless. Bye. Bye-bye.